This week on a special hour-long edition of Mountain Lake Journal, Aging Together in New York. We'll talk with the director of the state's Office for the Aging about New York's new master plan that's being developed and what policies and resources are needed to help older adults stay in their homes and live healthier, more fulfilling lives.
I think what we're hoping with the master plan is to kind of reevaluate and look at where are the gaps, what do we need to be doing, what are the priorities.
We'll discuss what's covered in the state plan and a new federal plan for the aging introduced by New York Senator Kirsten Gillibrand.
We understand that for older Americans, there are a lot of impediments to making sure that you get the health care that you need when you need it.
And we'll look at some of the new programs that are helping combat loneliness and isolation by providing seniors with comfort and companionship. Aging Together in New York, coming up next.
Mountain Lake Journal on Mountain Lake PBS is made possible in part by
Northline Utilities creates employment and training opportunities for North Country residents with projects that build community and social infrastructure. We're family-focused and education-oriented, power is our business, and pride is our choice.
Northern Insuring, guiding your way since 1930, with offices in Plattsburgh, Glens Falls, and Potsdam, providing personal insurance, business insurance, and life and employee benefit services.
Hudson Headwaters Health Network, providing primary care throughout the North Country for more than 40 years. Together, we're building healthier communities. Visit us online at hhhn.org.
Twin State Technologies. The cyber threat tempo, including ransomware, is real. Twin State Technologies provides trusted, innovative services that replace, augment, or update your existing system. Our goal is to stop hacking before it starts. Implementing big business solutions geared for the small business market. Twin State Technologies. Connect, protect, respond. More at twinstate.com.
Hello, everyone, and welcome to a special edition of Mountain Lake Journal. I'm Tom Hellick. For the next hour, we're going to talk about our aging population and a new master plan for aging that's being crafted over the next couple of years to come up with a comprehensive plan to help us better care for older adults and to help them live healthier, longer, more fulfilling lives, and in many cases, to be able to do that right in their own home with the loving care of their families. The COVID pandemic was challenging for all of us, but especially for seniors, many having a tough time dealing with the isolation and loneliness during the pandemic. But things are improving. For the first time in more than 3 years since the arrival of the COVID pandemic, the Senior Citizens Council in Clinton County held their annual Senior Celebration 2 weeks ago, a senior jamboree that brings together many of the organizations that help seniors with resources and services they need.
Information on health care services that are available in our community for seniors. You know, Lake Forest, we have Pine Harbor, you know, the different assisted living places, and just a lot of information. And they love to come because they like to get the information, but they really like the goodies.
All of this is valuable information and resources for them to be able to take back home and say, you know, something may have happened and they feel, you know, I need some help. Who do I call? They can look back into their bag of goodies and go, you know what? JCEO can help me get my, you know, yes. get me some more services in the home. Office for the Aging can tell me how to, you know, work the bus system. We all work together. That's one of the greatest things that I think works well with us in Clinton County, is that all of these programs work together.
Several of the seniors had a little extra get up and go in their step as they hit the dance floor, celebrating the first get-together like this that they've been able to enjoy since the start of the pandemic. It has been a challenging time. Yes, seniors have had to deal with isolation and loneliness. We're here to talk about that and the master plan for aging that's now being created here in New York State, an initiative by Governor Kathy Hochul to help address the needs of the nearly 5 million older adults living in New York State. And here to talk more about that and some of the many resources and programs already available to seniors is Greg Olsen, the acting director of the New York State Office for the Aging. Welcome, it's great to have you here. We're also joined by North Country Assemblyman Billy Jones, who represents the 115th Assembly District that covers all of Clinton and Franklin counties, as well as a few communities in Essex County. Assemblyman, good to see you. Welcome. We're also pleased to welcome Becky Preve, who is the Executive Director for Aging New York. Becky is the former director of the Franklin County Office for the Aging. Welcome. We appreciate you being here. And the director of the Clinton County Office for the Aging, Darleen Collins, is here. Welcome. So why don't we begin with Greg? The New York State Office for the Aging plays an important role in supporting older adults in the community. Tell us about what you do and what your network does.
Thanks, Tom. So the State Office for the Aging is our state's designated state unit, and every state has one. But really the name of the game is at the local level. We have 59 county offices for the aging. You mentioned Becky was Franklin, Darleen is Clinton. We have Chrissy Lurkey's here from Essex. We have 59 of those that cover the entire state. But more importantly, or equally as importantly, they work with 1,200 community-based organizations to provide services in the community and in the home with the single goal of helping older New Yorkers stay as independent as possible. And I think we're structured differently in that it's a top-down, bottom-up, but our network is really grassroots-oriented, and that's really different from a lot of other state agencies.
And you work with thousands of other community and faith-based organizations as well.
Oh, no question about it. I mean, there's 5,600 faith-based organizations, there's community action agencies, there's a lot of organizations literally that are serving not only older adults but children and families, because older adults live in families. The other beauty about having our offices for the aging county-based is there's a lot of other county agencies that they work with. Public health, mental health, substance abuse, transportation, et cetera. And you know what we always say is older adults don't live at the State Office for Aging or County Office for the Aging. They touch every single system, from housing to DMV, Department of Financial Services, health, and so on.
And your organization sufficiently funded?
Well, that's what we're working on with the Master Plan on Aging. I think that, you know, what we're trying to get across is the value that older adults bring to their communities, economically, socially, and intellectually, and to really change the way that the caring economy is structured. Growing older is not the problem. What is the problem is, over the last 50 years, how we've organized the caring community. And what I mean by that is we do very poor on prevention in the community and funding those types of services, and this is nationwide. And we spend a lot of money in healthcare and long-term care when it's almost too late. And I think that's what we're trying to figure out here in New York and certainly across the country with addressing social determinants of health. That's a new buzzword for the things that this network's been doing for 55 years.
Is it an old system that we're using, and is the master plan to reevaluate and look forward?
Yeah, I think that's exactly what it is. So the Master Plan on Aging is not just about aging, it's about the entire life spectrum. You start aging when you're born. And so I'll give you an example. If you're a child and you don't have access to food and nutrition, education, clean air, clean water, that's going to have an impact on you when you're 20, 30, and 40. The decisions you make when you're 20, 30, or 40 are going to have an impact on your as you grow older. So the short-term idea is, how do we help older adults remain independent, still working, volunteering, combating isolation? But the long game is, how do we start at the beginning and make sure that people have communities that help them grow up and grow old successfully?
And when we talk about older adults, about 4.8 million, what ages are we talking about?
We're talking 60 and over. That's our statutory charge, both at the federal and state level. But again, Tom, we have 3.7 million people between 45 and 59. And we also have about 4.1 million individuals that are providing some type of uncompensated care to somebody else, whether they be older, middle-aged, or younger. So half the population are individuals that we're really concerned about.
And I asked you about being sufficiently funded. That leads me right into the question about this year's New York State budget for fiscal years 23-24. How did NYSOFA fare in this year's budget process? Do you have the funding you need for all your programs you currently offer and for programs that you'd like to initiate or expand?
Yeah, it wasn't a bad year. The governor proposed baselining a lot of funding from last year, and that traditionally doesn't always happen. Working with partners like Assemblyman Billy Jones, Assemblyman Kim, who's the chair of the Aging Committee, they come together because they care about older adults. So we received an additional I'd say about $27 million, but you also have to look at other areas, investments in mental health, $25 billion 5-year housing plan, transportation. So again, you got to look at other agencies because older adults touch a lot of additional agencies. I think what we're hoping with the master plan is to kind of reevaluate and look at where are the gaps, what do we need to be doing, what are the priorities. We just finished the first ever statewide needs assessment survey, 27,000 responses to that of what's on people's minds that are over the age of 60. And that's going to be really important as we continue with the deliberations of the subcommittees for the master plan.
Assemblyman Jones, we're glad that you're here. Let me ask you, you were there for the past month as you and your fellow lawmakers worked out a new budget. Were there any particular senior services programs or needs that you went to bat for or supported in this year's budget?
Absolutely, and Tom, you said a month. It felt like 6 years, but anyway, we were only 33 days late with the budget, but that's another story. I think, and I'll speak very frank on this, I think we can always do more, especially in the aging budget. I'm proud that we were able to add $9.3 million for ISIP to get in-home services. We have many counties that have waiting lists to help them out, help them do that. But I think we could have done more in other areas, but we always feel that need, especially when it comes to aging. And I was able to get $200,000 for the Older Adults Technology Program, a unique program that we have right here in the North Country. The only other one in New York State is originally run out of Manhattan, so we're proud of that. There are other areas that we touched on. We got $1 million for the master plan as well. That's good. A little increase for the ombudsman program for to help out in our nursing homes. But Director Olsen touches on a very important point here. For years, and I know people on this stage and I know people in your audience have been saying, why are we doing things ass backwards here? Why aren't we helping people on the front end instead of on the back end? And to tell you the truth, if you want to talk about it's human beings, it's all of us, we're all going to age, but if you want to know the truth, economically it makes sense to do that. We want to keep people in their homes, we want to keep them healthy, we want to keep the communities healthy. Instead, we don't make the investment on the front end, and then we say, hey, you know what, you have to go to a nursing home now. Oh, you have to go to this other care. And it costs a tremendous amount of money. So why are we not making the investment on the front end, keeping people in their homes, keeping our communities healthy, keeping people where they want to be in their neighborhoods and in their communities and closer to their families? Instead, we say, well, okay, and then we continue to go through this cycle of having people having to be in nursing homes for specialized care and critical care. It just doesn't make any sense. So I'm hoping, and we're very hopeful with this master plan, that we're making steps into doing that. We've been saying it for years. We really have. All of us have been saying we need to make the investment on the front end, and then we won't have as much of a need, I should say, on the back end. So you're asking about the state budget. I think we should have and could have done more for our aging population.
I was just going to ask you about that. Any particular disappointments, funding you believe should have been included and either wasn't or was scaled back?
I felt that we should have added more money for our DSPs, for our home care workers. Always need, that's a huge need here, especially in our rural areas, because quite frankly, a lot of our home care workers, I mean, they're kind of aging out as well. And as you know, we have long distances to drive here. To get that care becomes more of a challenge to help people in their homes. So always advocating for more money for our home care workers. It's needed. They deserve it. I would say any time that we can support our home care workers through funding, we need to do that.
And Becky, I know you testified during the budget hearings. Were the programs and services you advocated for fully funded? We know the population of older residents in New York is growing rapidly. There is a demand for services. How is the overall funding for NYSOFA and the area agencies on aging?
Well, we were very pleased that we did get some investments in the New York State Office for the Aging budget, but I can tell you, and this isn't going to be a surprise to anyone, we run the largest home delivered meal program in the country, and that comes with the cost of food, the cost of transportation to deliver the meals. We also have about 13,000 people waiting for services in the community, from everything from a home delivered meal to actually getting a home health aide to come into the home. So although we did get that investment, we always would like to see more. And I think one of the difficulties that we find in my role representing the 59 offices for the aging throughout the state is that there's been huge issues with workforce, both internally at the offices for the aging along with the subcontracted staff. And as Assemblyman Jones said, the home care worker crisis has really impeded how we can serve people in homes and communities. And one of the really amazing things about our program specific to home care is we actually serve people that are above income for Medicaid. Medicaid is traditional payer of long-term care services and supports. We've subsidized people that are above Medicaid, but they can't afford to privately pay for the service. So a lot of teachers, paraprofessionals, et cetera, who aren't going to qualify for Medicaid but need some assistance in their home, we actually can provide the same service through the same licensed home care agencies on aggregate for less than $10,000 per year versus $135,000 on the Medicaid system in a skilled nursing facility. And when you look at what that traditional client is that we're serving, because we have very robust data from the counties, is that's an 83-year-old female who lives alone, is low income, has 4 to 6 chronic conditions, and needs help with things at home, such as taking a shower, going to the bathroom. And again, to serve that individual on paper would qualify to go, as Assemblyman Jones said, to either assisted living or a skilled nursing facility placement. You instantly impoverish that individual down to Medicaid. It's a huge cost to the state. So again, back to the prevention side of the coin, when I discuss with lawmakers, and we have a huge champion with Assemblyman Jones and others, that's the case that I make. We're investing everywhere in prevention programs, which makes sense, right? We have peer supports in schools to make sure kids don't start smoking or abusing alcohol or substance abuse. We're not doing enough to prevent the bad part of aging or to prevent people from having to impoverish themselves. Prevention programs like chronic disease self-management, we know as Director Olsen said, if we can get to people early on in that process and we can change health behaviors, we know that their longevity is going to be impacted. So in the overall state budget, we continually ask for significant investments, not only for the waiting list, but also to absorb that huge cost of inflation that the entire region has seen. Specific in the North Country, the cost of getting food for meal deliveries and the cost of gas has really impacted service delivery.
Inflation's hitting it hard. And you mentioned there are currently people who are going without services that would like to have
Correct.
Services?
It's about 13,000 people that have been assessed that need the service. I don't feel that that's a true needs assessment, because there's a lot of people in the community that if they do reach out for assistance and they're told we're going to be placed on a waiting list, a lot have to then transition and look to other service infrastructure to get those services. I do think one of the beautiful things about the Aging Services Network, and Director Olsen touched on this, is that the community then leverages other community entities. So even if, say Darleen couldn't serve an individual, they don't just tell that individual, sorry, we can't help you. They will work with other community-based organizations to make sure that we're serving individuals, and if that person may need to go to a higher level of care or get Medicaid, we'll actually do that on behalf of the client. So people aren't just turned away from the network. We're really resourceful in making sure that we make connections. But overall, I think as the population ages, we know right now we're 4th in the nation overall for the 60-plus population. We definitely need government to invest in the service infrastructure that saves long-term care dollars in the long run. And that's a benefit not only from a holistic standpoint for the individual, but it makes sense for the state lawmakers because it's going to contain your budgetary costs.
And Darleen, you're feeling the impacts here in Clinton County?
Absolutely.
You have folks on waiting lists?
We do, and we're constrained by budget and staffing.
How do you deal with that?
It's not easy. It's not easy when you have somebody who calls and needs help now, and it might be a year before you actually get to serve them in the capacity that they need.
You talked about turning to others in the community. Are there steps that you can take to try to help them?
Anytime somebody's assessed, if they have to be waiting for one program, it's what else can we get in place to help right now? What else is available? Who else can help? And really even helping the families try to identify more resources that they might have that they haven't recognized.
And is all of this putting their families in a tough position?
Absolutely. I mean, that's a lot of times how we get referrals is we have a stressed out caregiver calling and saying, I can't do this anymore, I need help.
And what would you say is the greatest need right now for older adults here in the North Country, in Clinton County?
In-home care is our biggest waiting list here. And we're working hard to reach caregivers before they get to that stressed out point and try to get them some supports before they're desperate. And
is the problem there just the labor shortage and just not enough workers, or is it the pay, or is it both? We know that, and Becky, this may be for you. We know there has been a push in Albany to try to raise the pay for caregivers and home health aides for a number of years now.
It's honestly twofold, Tom. So because the network uses the same licensed home care infrastructure as the Medicaid system, we're already at an unlevel playing field. And the reason I say that is because if I'm running a licensed home care entity and a Medicaid client is going to be authorized on average about 20 hours per week, that is a more attractive case to take versus one that Darleen might refer for 4 to 6 hours per week. And so that in and of itself has caused an issue. But here in the North Country, I can tell you, regardless of payer source, you could have $1 million to pay a home health aide. If you live in certain regions of this Tri-County area, there is no one to assist you. And in those cases, what we've tried to do is kind of transition and work on the consumer-directed care model, which is where the offices for the aging can use home care funds. The individual can identify a caregiver or a neighbor, train them to do the care, and then get reimbursed through the county office for the aging. So we're trying to get creative, but I can tell you, hands down, the largest issue facing any health and human services provider, hospital system or long-term system currently, is the lack of workers at that home health aide level, CNA level, at a skilled nursing facility. And these individuals, unfortunately, 50% of home health aides are reliant upon public assistance benefits because their pay is so low. So not only do we have a system where you lack workers, you're then forcing those workers that take these jobs to actually rely on Medicaid, SNAP, daycare subsidies, et cetera, because they don't make enough money to support their families, which is tragic. And I can tell you, and I don't think anybody here would disagree, I feel a home health aide's job is harder than any job that any of us will ever do in our entire lives. It takes dedication, it takes caring. They have to be social workers in the home. They deal with difficult families, difficult clients. They're eyes and ears for medical professionals, and we pay them minimum wage, which is something Assemblyman Jones and I have been working very diligently on to pass fair pay for home care, which would get aides to 150% of the regional minimum wage. And it would get them off the need for those benefit programs, and it would give them a job that they could feel proud to have.
Was there a pay increase in this year's budget?
Yes.
A small cost of living?
Yes.
4%?
Yeah, 4%, yes. But are you talking minimum wage as well?
Well, there will be the minimum wage passed, and that there will be an increase in minimum wage over the next 3 years.
We have an agreement to go above the minimum wage, an agreement that the state hasn't kept actually for the past couple of years, that whatever minimum wage was, that certain DSP workers would be $3 above that. We didn't keep our promise on that from 2 years ago. We're trying to keep our promise on it now. A lot of our home care workers, our home health aides, they're aging as well. And we don't have that supplement of younger workers to take their place. And it's no secret we're all getting a little older, and so I think we can see the writing on the wall that we're headed for. I think we're in pretty close to crisis mode now, but we're headed for some real issues here in the coming future.
To tie into that, Assemblyman, what I find intriguing, and I mentioned this at the Assembly hearing, is the front line of the New York Times in 1987 said home care workers were in a crisis. And here we are decades later talking about the same issue with an aging population, even less home care workers than we had before. And honestly, if you look at the economics of paying these wages, we actually worked with CUNY to do a research report 2 years ago that indicated there would be a twofold revenue increase overall in economic spillover by paying aides this enhanced rate, getting them off public service benefits, and also the spending that they would then do in the community where they could purchase a car or a home or go to the movies. So we have real-time data that would show the efficacy of doing this. But it comes with a big price tag on the front end, which is scary. But when you look at the demographics of the population, we're losing everywhere other than the 60 plus. We're going to have no caregivers, formal or informal, to care for the aging population, which again pushes them to skilled nursing facilities, which is going to cost millions and billions of dollars to the state of New York if we don't address the crisis.
There's many issues we have to address, and as I'm listening to what we've been talking about in terms of what we've known for a very long time, the question is, what's the solution, right? The way I think about aging is from a caring perspective as a geriatric social worker, but also as an economic development opportunity. And what I mean by that is we have to talk about aging different and show people what aging actually is. Because what we've been taught, culturally, we have isms. We have ageism, sexism, racism. Those are things you learn, which means those are things that you can unlearn if you have the facts. And let me just give you a couple of facts, because when you start to think about the older adult population as a group, right? So nationally, 83% of all the wealth in this country is held by older adults. They support 90 million jobs. And 40% of the federal, state, and local tax base. You look at New York State, 43% of our state's GDP, the development of goods and services, worth $719 billion, is older adults. They support 6 million jobs in New York State and represent 40% of the tax base. So you would not have a local, state, or national economy without older people. So if you are building up your caring community in the community, in addition to not spending down to Medicaid and going into a facility, which, by the way, there's only 160,000 beds in New York, and we got 4.8 million people. So that's not where they're going to go. They're going to be in the community. What winds up happening is you keep their economic, social, and intellectual contributions, their volunteerism, their entrepreneurship, their spending in the community.
Do many people have a misconception of older adults?
Of course they do. What people think about growing older, first there's fear, right? The image is of an older person who's in a nursing home with Alzheimer's disease. And certainly there are individuals like that, and it's our responsibility to care for folks like that, whether it be in a facility or the community. But the overwhelming majority of older adults are not that. They're working. We have 1 million volunteers providing 495 million hours of service at an economic value of $13.8 billion. They're the #1 givers to philanthropy, #1 givers to charity, they're the #1 entrepreneur group, and they're a huge tourism group. So we're here in the Adirondacks. Who do you think's riding around on their Harley Davidsons in the summer, or at campsites, or shopping at malls and stores, et cetera? So yeah, I think one of the things that our office has been doing now for a decade is starting every conversation with the value of the population and what they bring to family and community, so that we can talk about, well, then how do we help maintain folks? Keep your health so you don't decline. If you have chronic conditions, which are going to cost this nation $1 trillion by 2050, that are preventable and manageable, how do we do that so you can stay healthier longer? And then if you do need some assistance and supports, whether directly or a family member that might be providing that care, we can do those things in the community. Becky talked about the data we have. We are the best, we collectively, this network, are the best game in town. We're serving people that on paper could be in nursing homes, as Becky said, for under $10,000 a year. And that's where folks want to be.
There are some big developments happening on the policy level. You've touched on the master plan for aging, also NYSOFA's 4-year plan to the federal government. Tell us a little bit about that initiative.
Yep, so every 4 years we have to submit a plan to the federal government, and it really is designed to talk about how we're going to meet their priorities. And their priorities and ours match, but we do so much more than what they're asking us to provide. And one of the great things we're doing, and I think this is really important, Tom, is the state and the counties are the primary financer of the services that we provide. Yet our charge is from the federal government. The federal government is the least funder of the work that we do. And we've been working with Senator Gillibrand, and Becky and I drafted a Older Americans Act modernization plan. So Older Americans Act is our federal charter. And we organized my counterparts across the country and her counterparts across the country to get behind our plan and they did. And what we're calling for is over $2 billion annually to be added to the Older Americans Act, which would bring an additional $180 million to New York State, which would then go to Darleen and Chrissy and others, where they can pay for aides, they can provide transportation, they can hire more staff, they would have administrative dollars, they can innovate. What we try not to do is tell the counties what they have to do. I mean, they know the things that they need to do, but there's so many nuances depending on the community. And it's up to Darleen to be able to, if she had the resources, to say, this is a need in my community, and I have the resources to match it. So what we're doing is calling on the federal government to step up. The Older Americans Act has been reauthorized 15 times. More work has been added to us and then ultimately the counties. All of it, Tom, has been appropriate, but none of it's come with any money.
Older Americans Act dates back to the mid-'60s.
1965.
It's been updated a number of times, but
15 times.
Desperately needs it again.
Absolutely. So the Older Americans Act was passed in '65 with Medicare and Medicaid. Why? Because the design of what these guys do every day is keep people out of hospitals, keep people out of the emergency room, keep people out of the nursing home. But equally as important, if you wind up in one of those settings, you're going to be discharged home. And the only way you're going to succeed at home is if you have the services in your home and community so that the discharge plans can make you successful.
You also recently joined Senator Gillibrand to endorse her master plan for the aging that she and a committee are working on in Congress. The senator came to the St. Regis Mohawk Tribe's Senior Center in Akwesasne just last month to unveil her plan.
Welcome to a truly historic day here in Akwesasne. For the first time in recent memory, we are welcoming a U.S. Senator, Kirsten Gillibrand, to our community.
The senator, who is a member of the Special Committee on Aging, paid a visit to the St. Regis Mohawk Tribe Senior Center, where she met with seniors and administrators.
Welcome, U.S. Senator Kirsten Gillibrand.
Thank you so much, Chief. Thank you, Chief Connors. Thank you so much.
The senator outlining a 5-point plan that she says is urgently needed given the rapidly aging population here in the U.S.
We understand that for older Americans, there are a lot of impediments to aging in place, to making sure that you get the health care that you need when you need it. And so I have been working over the last few months on a master plan on aging. And the purpose of this master plan is to make sure we have legislation to solve each of these problems and to really show our older Americans that we not only care about them, but we want them to not just survive, we want them to thrive.
For Gillibrand, priorities include addressing food insecurity, expanding the availability of nutritious meals at senior centers like this, and food banks.
So we are about to write the Farm Bill, and in the Farm Bill, we are going to do a lot of work to make sure we have more meals and more healthy meals and more resources for our food banks so that they can provide more healthy meals throughout the whole region.
The senator says along with getting Medicare to cover vision, hearing, and dental, Congress is also looking for ways to lower prescription drug prices and help seniors age in place.
I think the two main things for most seniors is being able to afford their medicines. And so we got a bunch of drug prices down last year. Insulin's capped at $35 a month, and we got a total cap of $2,000 a year. But in a community like this that lives so close to Canada, they should be able to buy drugs in Canada if they're cheaper as well. Second, I think that there's a lot of interest in aging in place, making sure that our seniors can stay at home and can have access to home health aides. We don't pay home health aides enough, so we don't have enough of them.
Gillibrand's plan also aims to help seniors' financial security, protecting Social Security, and would provide police with more resources to go after scammers, thieves who target seniors looking to steal their money. So back to Greg now. How is Senator Gillibrand's plan and Congress's master plan different or the same as New York's?
Yeah, and first I got to just say, Senator Gillibrand is an absolute hero. Becky and I sit on her aging committee. It's a little bit different, but what she has done is listen to folks like us and others in the group and understands what needs to be done. Changes to the Older Americans Act, And then what she's calling on for her master plan is to have something within the Administration for Community Living, which is who oversees us at the federal level, to provide funding so that all the states can develop their own master plans. Because what she recognizes is the population's getting older. But again, I want to put a caveat. Getting older is not the problem. It's how we've organized our caring community to focus on the most expensive back end, so that as she understands the economics and the value of the older population. And so that's what she's trying to do, is turn, I think, what we've been developing at the state level into a national priority, and not having older adults be an afterthought.
Some of what's in her plan, it focuses on drug prices, prescription drug prices. That's up to the feds to negotiate those prices and try to help people with prescription drug prices, keeping Medicare, Medicaid, Social Security solvent and funded. Is there anything else in her plan that's desperately needed by seniors here in the North Country and in New York State?
Funding our network. That it's exactly what's needed. Now, Social Security can easily remain solvent, and folks know what that cure is. It's a political issue. There's a cap on how much tax you pay, and once you get above that cap, which is only about $150,000, you don't pay any more. That would solve the problem right there. So she is spot on in terms of what's important. Healthcare is critically important. Long-term care is important. But the 20 plus programs and services that we administer that are provided by the county offices and their partners, that's where the game is. The game is in the community.
Governor Hochul announced the creation of the state's master plan on aging last November, that it's being developed right now. Public hearings are being held and stakeholders are being asked to weigh in and help create it?
Yep, so where we are in the process is we have a state agency council with 20 plus agencies for the reason I mentioned earlier. Older adults live in a whole variety of different agencies. We have a stakeholder council, which is large as well, and then we have an association council. We have probably 9 or 10 subcommittees underneath the council, so those are all meeting as we speak. Once we get kind of a draft plan going over the course of mid to late summer, we will be out in the community asking people what they think. So it's never too early to get involved. Again, we just did our statewide survey. There's going to be another survey, but there's going to be a lot of interaction, and there's a lot of stakeholders, whether they be for aging or for others, that really need to weigh in. Because again, state government, it depends on who you talk to. You can't make policy from a tower in Albany. It's at the grassroots. You got to talk to people that live this stuff, that serve people every day, because they're the experts.
And what's the timetable?
The executive order said that we have to have a report due to the governor in the spring of 2024. It's not a one and done. It's a report and then you're done. This is going to be a live, living, working document for decades to come.
And Becky, obviously the area agencies on aging at the county level are so tuned into the needs of their communities. They'll provide critical recommendations for the state master plan?
Correct, and the nice thing is, as Greg said, there's that state agency subcommittee, then there's the association subcommittee, so I am able to serve on that on behalf of the 59 offices for the aging. And then in the subcommittee structure, which is laser focused really on targeted ideas, long-term care services and supports, home and community-based services, health and wellness, elder abuse and fraud. Those subcommittees are populated with my colleagues from different organizations as well as individual directors from communities. So what the master plan is really trying to do is to not just take, a singular look at aging through one lens. They're working not only with, offices for the aging, they're working with public health departments, veterans agencies, local not-for-profits that combat social isolation and exploitation, and really just people from different walks of life that may have different advice to give based on their lens. And the hope is that all those lenses will come together to get a really comprehensive roadmap for the next 10 years on how we look at aging.
And Assemblyman, will lawmakers be weighing in on it?
Yes. We need to put our money where our mouth is and provide them with the resources that they need. They know best of what their community members need, what their aging population needs, and what their families need. So we just need to put our money where our mouth is. We say it every year. Oh yes, we're going to do so much. We need to do so much. We love our aging population. We love our communities. We want them to stay in their homes. Well, let's do something about it and get them the resources that they need to help people do that.
Greg, Your office has long been involved in efforts to combat social isolation in older adults. And has the COVID-19 pandemic severely impacted the older population?
Yeah, it has. It's impacted all populations. I mean, older adults are a little bit more resilient. The younger population's been hit extraordinarily hard, but your question was about older adults, and the answer is absolutely. Clearly, when you have a stay-at-home order for people over 75, people with compromised immune systems and chronic conditions, and basically the state was shut down, that's going to make the problem a lot worse. What came out in 2018 was a AARP and CMS study that showed the impact of isolation and loneliness. Cost Medicare $7 billion to treat people. It's the equivalent of smoking almost a pack of cigarettes a day. There's been a lot of additional research. It causes suicide, depression. It will actually kill you. So there's a lot of data associated with that. So what we tried to do is recognize that we live in a technological society. Now, tech is never going to replace a human being, but I can't snap my finger and have somebody show up at the door of an older adult who's alone. So we've launched things like our award-winning animatronic pet project. We've put out over 21,000 pets as of this month, and that's being replicated now in 35 states. It's being used at the Veterans Administration, mental health. We have other tech platforms like Get Set Up, where you can have access to over 2,500 classes. We are fully subsidizing that for anybody over the age of 50. We have a very unique project called with LEQ.
Good morning, Juanita. How are you today?
Which was developed by Intuition Robotics, and this is just fantastic because it's the only proactive technological platform I've ever seen. And what I mean by that, because I've been demoing one in my house, is that when I receive it, it engages me. I don't have to sit in front of a computer, click a button, figure out what class I want to take, what day I'm going to take it, and then remember to do that.
So that's an important part of it, the interaction, but at the same time also will ask questions about health and
remember. So I could come and she would say, Greg, how was your day today? And I say, my day was great. I'm golfing with my father on Friday. And she will remind me Thursday night not to miss that golf game. So she remembers, and you build a relationship because it's artificial intelligence, and she remembers our interaction and builds a friendship based on me specifically. So everybody's interaction is going to be unique and different.
And how many of these are there across New York now?
We have put out, in partnership with Becky, about 910 all throughout New York State.
All the counties. Are there some in Darleen in Clinton County?
And it's one of my favorite projects. There was a staff learning curve on who really it fits best for, but we've had some really great success with it. I have an 83-year-old who's never used anything more technological than a remote control for the television, who engages with it every single day. Won't use every function on it, does trivia, brain games, tours museums, but interacts with this thing every single day, multiple times a day.
And looking at expanding, Greg?
Well, what we're looking for first is the data. So there's nothing we're putting out there that we're not measuring. The efficacy, what it means to people, but also the raw data. So we're about 2 quarters in, about 6 months, 7 months in. So we're getting real-time data. We're getting user feedback like Darleen talked about specifically, but we're also getting 4 fairly large buckets of overall health and wellness that the company is attributing. And as we're seeing things come through, you know that it's effective, but we want to wait until the end and then for a lot of these projects and see if there's an opportunity within the state budget to expand. I got to give, again, Governor Hochul a lot of credit. She, at our request, put $2.9 million in our budget last year to sustain many of these programs because they work. And if you can show that they work with data, that makes it a lot easier.
Greg, you mentioned the robotic pets. Reporter Jolene DeRosier from our partner PBS station in Watertown tells us more about how they're helping seniors in need of companionship.
As our loved ones age, finding ways to shift their perspective or keep them company when we can't can be a challenge. But thanks to a program that was launched in New York State in 2018, there's a solution. In a world where artificial intelligence is moving to the forefront, animatronic animals are fast becoming a powerful solution. You're about to meet 2 seniors and their furry robotic pets. And according to the Office of the Aging in Albany, These artificially intelligent creatures have changed feelings of isolation and loneliness by 75%. They're small, they're friendly, and they're easy to care for. You're looking at 3 animatronic pets manufactured by Joy for All and available to seniors like Ruth Gates of Carthage through the Office of the Aging in Jefferson County.
My cat's name is Noodles. I really just looked at him and said, Noodles. Hi, Noodles.
Ruth is one of hundreds of seniors in Jefferson County to be paired with a motion-censored companion.
What are we going to do today, huh?
Noodles eases her loneliness. Her husband has passed on and her children are grown. So when she starts each day, this gray and white ball of fur gives her the comfort she needs.
Well, when I wake up and Noodles hears me moving around, she makes a little noise, and lets me know that she's awake too. And I get up and come out in my room, my living room, and I say, hi, Noodles, and she comments back to me with sometimes a little purr or shake of her head. And then I go and get my breakfast, and after I've eaten, I sit here and have prayer, and Noodles and I have prayer, and I talk to her, and she purrs and so on. And so throughout the day, I do the same thing. I pick her up and cuddle her and pet her and put her back down. And before I go to bed, I tell her good night. She's just company.
I get lots of calls from seniors. They'll call me to tell me what their pets' names are. I have one senior that will send me a picture of the different outfits they put in their dog. The family said that was the best thing I did for my mom. It gives her something to interact with, where I wasn't seeing a lot of interaction. She would just stare at the TV all day. Now I see her hands moving. I see her calmer when it's time to go to bed. It's something that's there with her.
They reduce agitation. They reduce anxiety. We've seen people come off medications because they're calmer, less depressed.
Bob Miller of Fulton also has a robo-companion. This is Sparky, and he's most active when Bob is watching TV with him.
What I do now is I have him sitting in a chair, and he's turned on, and every time I turn the station, that sensor, he'll bark. I learned about my dog Sparky through the Office of the Aging, which was through a woman called Elizabeth Weiner.
Just came to stop by and see how you're doing.
All right. Check it up on me, huh?
Always.
My wife was in a nursing home with Alzheimer's, advanced case of Alzheimer's. And I was going through a bad case of depression. And with all my friends being dead and being isolated where I live, she thought this would be a good fit for me to give me some companionship at that time with my bad case of depression.
A lot of our seniors don't have neighbors right by. A lot of our seniors don't have that consistent phone call from somebody to call them. This is their purpose. When you think of seniors as they age, their only thing to get up for usually is because they either have to go to the bathroom or eat, or if they have something to take care of. So this is their reason for some of them to keep going, is they have a pet. They have something that's going to show them some kind of an interaction or some kind of, a reason to just keep going day by day.
Just seems like a real cat when you have it in your arms, and just makes you feel content and comfortable.
He's very talkative. And he's very active. He's moves on sensors. So if you're talking, usually he'll speak up to you. So at that time, when I was going through this bad case of depression, even though it's a robot, it's just the idea to hear him bark. It was just the idea that there was somebody else here besides me.
These animatronic pets are just the tip of the iceberg when it comes to programs that help our seniors cope with feelings of depression, isolation, and loneliness.
Greg, are these really making a difference, these pets?
They're absolutely making a difference. So we started this project before the pandemic in 2018. Our office bought 30 cats, 30 dogs. We asked for the counties to volunteer if they thought that this was a project that they wanted to be involved in, and what we wanted to do was study it. And so we did. What we found was a 75% reduction in isolation and loneliness after a year. And so we knew they were going to work because, Tom, look, it doesn't matter how old you are, there's things that make us tick. Arts and culture, music, pets, and it doesn't matter how old you are. And so that really launched us. So when the pandemic happened, That's when we really exploded with this, and we have now gone through 5 rounds of purchases. Our last one was just this month, and we've got 21,000 pets out. They added a new product called the Walker Squawker, and what that is either a bluebird or a cardinal that goes on an individual's walker, so that if you get up from your chair and you forget your walker, the bird is going to let you know, and that's really important because that helps prevent falls, injuries.
And are you hoping to expand the program?
We're expanding every year. That was one of the items we were able to get in the budget last year for sustainability.
And Darleen, what's been the response from seniors in Clinton County?
Oh, they absolutely love them. They bring them with them places, and if you introduce one into one senior apartment facility, you get a flurry of phone calls saying, I want one too.
And of course, you don't have to feed them, you don't have to walk them, yet they provide that comfort and companionship. Some of the other issues that we always know we talk about with seniors: housing, transportation, some we touched on that a little bit earlier. Greg, you were talking about transportation. Assemblyman, you had a bill that created a task force that was last session, and that's happening now. What is the idea behind that task force?
Well, it's certainly to bring all the the key stakeholders together, to bring local county transportation departments on board, state stakeholders. Where are the needs, first of all? And certainly when you talk about that in rural settings like ourselves, like where we are, and how it affects our aging population, because that's what we're talking about. We want to come up with a comprehensive report that states what our needs are and then act on it.
And does this look beyond just public transportation and creating public transportation?
Yes, I think we're talking about all kinds of transportation. We talked about home health care aides before, and home health care workers, and how transportation becomes an obstacle for them to actually get to the people that they're caring for. I actually had a bill in, have had a bill in for many years, on how we compensate for mileage paying for that for them, because I think it's needed in our rural areas.
Other topics we cover with our panel include housing and new community housing projects in Plattsburgh and Malone that are close to supermarkets, medical care, and public transportation. And a home-sharing pilot program that's working well in Vermont, now being tried in New York. Seniors share their homes with tenants who help with grocery shopping, cooking, or even caregiving.
I thank all of you guys for being here today. You've touched on a lot of points that are very important to.
And our panel also heard questions sent in by viewers and from stakeholders and advocates from our studio audience about programs like AmeriCorps Seniors, a network that connects senior volunteers to deliver meals or help assist seniors in need.
We do provide an array of services to help aging in place older adults stay in our homes for longer and as long as possible. Some of those services have been discussed, such as home-delivered meals, AARP Tax Foundation, tax assistance and preparation, and friendly visiting and companionship, and of course, drivers for medical appointments, as well as during the pandemic, volunteers in the North Country did not stay home. They were essential volunteer laborers who did provide grocery shopping for individuals. That was a pilot that now has turned into grocery shopping assistance and grocery shopping transportation. With more resources, we can of course do more. The question as an older adult that I receive, and as a program director, on most of the minds of the folks that we speak with in the North Country is rural transportation. One of the priority populations that our AmeriCorps Seniors program serves are veterans. We work in concert with the VA, and we receive many calls. I received 3 today before I came here to provide medical transportation. These are folks that need to go to Saranac Lake for treatment, and also many, many times now more and more Burlington for treatment. How can we address that rural population with rural transportation? Thank you.
I know we can do more to address that and help out with cutting some of those, not cutting the regulation, so much as redesigning that. And hopefully through the Rural Transportation Task Force, we'll address some of those issues and make sure they do.
First of all, thanks for all that you do. RSVP, foster grandparents, the AmeriCorps programs are outstanding. They need to be invested in more at the federal level for sure. There's other solutions. So this task force is going to be really important, and transportation really impacts everybody, older adults as well as others, to get where they need to go. So you have a public transportation system, and then where are the gaps? So there's a couple things that we're doing. There's a rural transportation program called ITN out of rural Maine, the Independent Transportation Network. We have a couple of pilots in New York State. They have a variety of very unique ways to raise funding to be able to pay volunteer drivers. It's really volunteer based. So they're working with the CDC at the national level to develop a nationwide campaign to get volunteer drivers. So I think that will be helpful in New York. We are in the middle of a pilot now with a new rideshare program called GoGo Grandparent. We're testing it in Erie County, Monroe County, and Suffolk County. And that's a specialized rideshare program where the drivers are trained in the unique needs of older adults. But that was one of the things we got in the budget last year, where we'll be growing capacity throughout New York State over the next 5 to 10 years. The final thing is we launched, because of the volunteer rates going down over the last 20 years and then really bad during the pandemic, we implemented a stipend program for our long-term care ombudsman volunteers and our HICAP, our Health Insurance Information Counseling Assistance Program volunteers. And it's been extraordinarily successful. So I think that's something we could look at for drivers to use their cars. They're already going to be paid with mileage, but if you could give them something extra to say thank you and to encourage additional people to volunteer, and not just older people, I think we could be getting college students and others who can join this. So I think you're spot on, and there's a lot of work to be done, and hopefully the start will be this task force and then some of these other pieces we can bring to the table.
And also suggestions for the master plan for aging, like helping seniors not only become more tech savvy, but also providing them with technical assistance.
What I'm seeing that's happening in our aging community is that technology is increasing, but the level of technical support, expertise in providing support to seniors is decreasing. I think you might know that Best Buy and the Geek Squad went out of the community. And what I'm hearing a great deal is that there's no one to help them. So it's a mandate that our entire society, and that does not leave out our seniors, that they need to focus on technology. They need a computer and a phone to access. They need a portal to access their doctor. But when there's a problem, if the phone breaks or the computer breaks, there's no one out there to help.
I'm really glad you raised that. It's the first time I've ever heard it. I think, between Senior Plan, it gets set up, and a lot like Cornell Cooperative Extension, there's a lot out there in terms of teaching people. But that's the first time I've heard about fixing stuff, because you're right. Where I go, I can go right to the mall, to Best Buy, or whatever, to have it fixed. But out here, you're exactly right. I appreciate you raising that.
A lot of colleges will look to partner their students with older adults. So, that might be something you could explore, Darleen, you could explore with the college to see if any of their students would be willing to have that as part of their curriculum. They do that in other areas of the state for training, not for repairs, but that might be one of the solutions. But I agree with Director Olsen. It's a great thing to bring back to the Master Plan on Aging Committee.
By the way, we want to mention that Greg will be a panelist for an educational forum coming up on June 7th at Paul Smith College, hosted by Mercy Care for the Adirondacks. Greg and Adam Earps, who is Deputy Commissioner of the New York State Department of Health, will be keynote speakers talking about the Master Plan for Aging in New York. Also, Ann Monroe with the Health Foundation for Western and Central New York will be speaking on the topic of ageism. You can go to Mercy Care's website to learn more and sign up for the event. And we want to thank our guests for joining us, Greg Olsen, Billy Jones, Becky Preve, and Darleen Collins. And thank you for watching this special edition of Mountain Lake Journal. We have special programming all week as we team up with our fellow PBS stations across New York State to focus attention this week on aging together in New York. For all of us at Mountain Lake PBS, I'm Tom Halleck. Have a good night, and we'll see you back here next week for an all-new Mountain Lake Journal. A program note, because our forum ran a full hour, New York Now will be seen this week at a special time, Sunday morning at 11, here on Mountain Lake PBS.